Let me ask you something personal. Something most men over 60 would never say out loud. Not to their doctor, not to their wife, not even to themselves. Are you still as strong, as vital, as alive as you want to be? Because what I'm about to share with you today might completely change how you think about your body, your prostate, and your energy for the rest of your life. Stay with me. This is important. I'm Dr. Naomi Sato, a urologist with over 12 years of experience helping men like you regain their energy, performance, and vitality. If you're new here, welcome to the channel. Before we go any further, if you're serious about protecting your prostate, staying strong, and living without fear, hit that subscribe button and turn on notifications. I share real information backed by real science for men just like you. And if this topic matters to you, type 1 in the comments and tell me where in the world you're watching from. If not, type 0 so I know how to help you better next time. Now let's get into it. Here is the truth that most men over 60 never hear from their doctors. What happens in your bedroom or in your private moments is directly connected to what happens in your prostate, your bloodstream, your brain chemistry, and your overall quality of life. Not someday, right now, today. I've sat across from thousands of men in my clinic. Men who are 62, 67, 71, 74. Strong men, accomplished men. Men who raised families and built careers and fought through hard seasons of life. And so many of them carry the same quiet question buried somewhere deep, a question they feel embarrassed to ask. Is it still okay to ejaculate at my age? Is it helping me or hurting me? Should I be doing it more, less, or not at all? And here is what breaks my heart a little every time. Most of these men have been living with myths, with silence, with guesswork for years. Nobody ever sat down with them and explained what was actually happening inside their bodies. That ends today. Because I am going to walk you through everything. The 5 real benefits of regular ejaculation for men over 60. The 5 genuine risks you absolutely must be aware of. And the practical, science-backed guidance that will help you figure out what is right for your body, your prostate, and your life right now. So settle in, because this is the conversation your doctor probably never had with you. But first, let me tell you something that will reframe this entire discussion. Your body at 60, 65, or 70 is not a declining body. It is an adapting body. There is a profound difference. Decline suggests something is ending. Adaptation means your body is responding, adjusting, and looking for signals from you about how to perform. And one of the most powerful signals you can send your body, especially your prostate and your cardiovascular system, is the signal of regular, intentional sexual activity. Are you sending that signal? Or have you gone quiet? Let us find out why that answer matters more than you think. Benefit number 1. Your prostate needs this more than you know. Here is a fact that surprises almost every man I share it with. Your prostate is not a passive organ. It is an active gland. It produces fluid. It stores that fluid. And if that fluid sits stagnant for too long, it creates an environment where inflammation, cellular damage, and over time, serious disease can take root. Think of it like a river versus a swamp. A river that flows regularly stays clean, oxygenated, and healthy. A swamp that sits still becomes murky, thick, and dangerous. Regular ejaculation keeps your prostate flowing like a river. A landmark Harvard study followed over 30,000 men for nearly 20 years and found that men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to men who ejaculated far less frequently. 21 times. That is roughly once every day or two. Now, biologically, what is happening? Ejaculation physically flushes the prostate. It clears out old cells, carcinogenic byproducts, inflammatory agents, and built-up secretions that, left undisturbed, could trigger cellular mutations. Emotionally, this gives men over 60 something incredibly powerful, genuine evidence-based reassurance that staying sexually active is not indulgent. It is protective. Practically, this means that one of the most accessible natural tools for prostate health is something your own body was designed to do. And we are just getting started. Benefit number 2, circulation and cardiovascular health. Here is something I want you to picture. Every time you become aroused and reach orgasm, your heart rate increases, your blood vessels dilate, and blood rushes through your entire vascular system with renewed force and urgency. This is not just a pleasant sensation. This is a full vascular workout. For men over 60, cardiovascular health is everything. It determines erection quality, brain sharpness, muscle function, and even emotional resilience. And here is the connection most men miss. Poor circulation and erectile dysfunction are not separate problems. They are the same problem wearing different faces. When a man over 60 tells me his erections are weaker, I do not just think about his sex life. I think about his heart, his arteries, his blood pressure, and his risk of stroke. Regular orgasm helps keep your blood vessels elastic and responsive. Biologically, it trains your vascular system to dilate on demand, which is exactly what healthy arteries need to do. Emotionally, improved erection quality restores confidence in a way that nothing else quite replicates. Practically, this means staying sexually active is one of the few pleasurable forms of cardiovascular maintenance available to men in their 60s and 70s. Keep watching, because what I am about to share next surprised even some of my most skeptical patients. Benefit number 3, hormones, mood, and the morning after 60. Let me tell you about a patient. I will call him Bernard. Bernard was 68 years old when he first came to my clinic. He described himself as flat. Not depressed exactly, just flat. Low energy, low motivation, sleeping poorly, feeling detached from his wife even though they had a strong marriage. He had assumed it was just age, that this was simply what 68 felt like. What Bernard did not know was that his brain chemistry had quietly drifted, and one of the contributing factors was a significant reduction in sexual activity, which had been gradual and unnoticed over the previous few years. When we ejaculate, the brain releases an extraordinary cocktail of neurochemicals. Dopamine surges through the reward pathway, restoring motivation and pleasure. Oxytocin floods the system, deepening feelings of connection and emotional bonding. Endorphins quiet pain and anxiety. Serotonin stabilizes mood and promotes a sense of calm contentment. And then, shortly after orgasm, prolactin rises, which is the hormone directly responsible for that deeply satisfying, heavy-limbed, ready-for-sleep feeling. For men over 60, this neurochemical reset is not a luxury. It is medicine. Because after 60, dopamine production naturally slows. Oxytocin levels decline in long-term relationships unless actively stimulated. Serotonin regulation becomes more fragile. Regular ejaculation is one of the most natural ways to counteract all three of these trends simultaneously. Biologically, it rebalances brain chemistry. Emotionally, it combats the quiet flatness that Bernard described, that so many men over 60 recognize in themselves. Practically, it means better mornings, warmer relationships, and a brain that feels more like it used to. Bernard came back 3 months later and said something I will never forget. He said, "Dr. Sato, I feel like myself again." That is what we are talking about here. Benefit number 4, sleep quality and recovery. This one is short, but do not let its brevity fool you. It is significant. Men over 60 overwhelmingly report difficulty with sleep, trouble falling asleep, waking at 3 a.m. with a racing mind, never feeling fully rested. The consequences of poor sleep at this age are severe. Accelerated cognitive decline, higher cortisol, weakened immunity, increased cardiovascular risk, and lower testosterone. The prolactin released after ejaculation is one of the body's most potent, natural sleep inducers. Combined with the cortisol reduction from endorphins and the muscle relaxation triggered by oxytocin, orgasm creates a biologically optimized state for deep, restorative sleep. Biologically, it is a sleep protocol your body already knows how to run. Emotionally, it replaces lying awake with worry with lying down in genuine chemical calm. Practically, it means that for men who struggle to sleep, regular ejaculation before bed is a clinically reasonable, zero-cost, zero-side-effect intervention worth trying. Now, before I get to benefit number 5, which is the one my older male patients find most surprising, I want to pause for just a moment. If you are finding this information valuable, if you feel like this is the kind of honest, science-backed conversation you have been waiting to have, please subscribe right now. Hit that button, because every single week, I come back to this channel with content exactly like this. Content designed for men over 60 who want real answers about their health, their vitality, and their longevity. You deserve access to this information. And subscribing ensures you never miss it. Now, back to benefit number 5. Benefit number 5, immune system activation. Your immune system weakens with age. This is called immunosenescence, and it is one of the primary reasons older men are more vulnerable to infections, slower to heal, and at higher risk for certain cancers. What most men do not know is that sexual arousal and orgasm have a measurable impact on immune function. Studies have shown that sexual arousal elevates levels of immunoglobulin A, known as IgA, one of the body's primary frontline antibodies against bacteria and viruses. This effect is compounded by the cortisol reduction that accompanies orgasm, because chronically elevated cortisol, which is extremely common in stressed older men, directly suppresses immune function. Biologically, regular ejaculation contributes to a more active, responsive immune environment. Emotionally, this gives men over 61 more reason to stop feeling guilty or self-conscious about sexual activity and start recognizing it as part of a comprehensive approach to healthy aging. Practically, it will not replace your flu shot, but it is a genuinely meaningful, enjoyable addition to your immune-supporting lifestyle. 5 benefits. All real. All backed by science. All directly relevant to men in their 60s and beyond. But now I have to be honest with you, because staying quiet about the risks would not be fair to you, and it would not be the kind of doctor I intend to be. Drawback number 1, compulsion and loss of control. There is a clear and important line between healthy, intentional sexual activity and compulsive behavior. For most men over 60, compulsion is not the primary concern. But it is worth naming because the digital age has made compulsive pornography use and compulsive masturbation more common across all age groups than most people admit. If you feel driven to ejaculate not out of desire or pleasure, but out of anxiety, boredom, or habit you cannot seem to break, that is worth paying attention to. Biologically, compulsive patterns can dysregulate your dopamine system, making natural pleasures feel dull by comparison. Emotionally, they create a cycle of shame that quietly erodes self-worth. Practically, they interfere with real intimacy with a partner and can crowd out other meaningful activities. The question to ask yourself honestly is this: am I choosing this, or has this become something that is choosing me? Drawback number 2, over-reliance as an emotional escape. This one is subtle but important. Ejaculation reliably produces a short-term improvement in mood. For men who are dealing with grief, loneliness, chronic pain, or anxiety, that short-term relief can become a default coping mechanism that prevents real healing. This is not unique to sexual behavior. Any reliable pleasure can become a way of avoiding what actually needs our attention. Biologically, repeated use of one relief pathway can suppress motivation to seek other, more sustainable forms of support. Emotionally, it can keep a man stuck, numbing the signal rather than addressing its source. Practically, if ejaculation is the primary way you manage emotional pain, it may be time to build a broader toolkit. Movement, connection, therapy, creative expression, spiritual practice. Sexual activity can absolutely be part of emotional wellness. It should just not be the whole of it. Drawback number 3, physical fatigue if frequency is too high. For men over 60, energy and recovery work differently than they did at 35. Testosterone levels are lower. Cellular repair takes longer. The refractory period, meaning the time your body needs to recover after ejaculation, is significantly extended. Daily ejaculation that is not matched by adequate rest, nutrition, and recovery can compound fatigue rather than relieve it. Some men in their late 60s report feeling drained, foggy, or physically depleted after high-frequency sexual activity, and this is a real, physiologically grounded response, not a psychological weakness. Biologically, your body allocates energy and nutritional resources to sperm production, glandular secretion, and nervous system reset. Emotionally, persistent fatigue from over-frequency can chip away at confidence and motivation. Practically, for many men over 60, every 2 to 3 days may be a more sustainable and energizing rhythm than every single day. Drawback number 4, reduced sensitivity and diminished desire. Here is one of the quieter paradoxes I see in older men who masturbate very frequently, particularly with intense stimulation or pornography. Over time, their real-world sensitivity decreases. The brain's dopamine response becomes calibrated to high stimulation, meaning ordinary intimacy with a partner begins to feel underwhelming by comparison. This is not a moral judgment, It is neuroscience. Your brain adapts to whatever inputs it receives most frequently. Biologically, high-frequency, high-stimulation ejaculation can dampen the dopamine response to subtler, more relational forms of arousal. Emotionally, this can create distance in long-term partnerships and a quiet dissatisfaction that is hard to name. Practically, taking intentional breaks of several days or consciously choosing slower, more mindful stimulation can restore sensitivity and reignite genuine desire. Drawback number 5. Pelvic floor tension and physical strain. This is the drawback I see most often overlooked, and it is particularly relevant for men over 60. Rushed, tensed, or physically strained ejaculation puts significant pressure on the pelvic floor muscles, the prostate, and the urethra. For men who already experience urinary symptoms, benign prostatic hyperplasia, or pelvic tightness, this can worsen discomfort rather than relieve it. Biologically, chronic pelvic floor tension creates a feedback loop of tightness, poor circulation, and inflammation in exactly the region we are trying to protect. Emotionally, pain or discomfort associated with ejaculation creates anxiety that compounds performance pressure. Practically slow, relaxed, non-rushed sexual activity combined with pelvic floor awareness exercises makes a significant difference. If you experience any pain, burning, or significant discomfort during or after ejaculation, that warrants a direct conversation with your urologist. Do not wait on that one. So what is the bottom line? Let me bring this full circle for you. You are not too old for this conversation. You are not past the age where this matters. In fact, for men over 60, these questions matter more than ever because the stakes are higher and the benefits are more concentrated. Your prostate is counting on regular flushing. Your cardiovascular system is counting on vascular exercise. Your brain chemistry is counting on neurochemical resets. Your immune system is counting on that IgA activation. And your partner, if you have one, is counting on your presence and your vitality. But vitality requires self-awareness. So here are your takeaways. Pay attention to your energy levels after ejaculation. If you consistently feel restored and clear, your frequency is probably working for you. If you consistently feel depleted and foggy, consider reducing frequency and prioritizing recovery. Aim for relaxed, unhurried sexual activity. Let your pelvic floor stay soft. Let your breath stay steady. Let it be something your body enjoys rather than something it strains through. If you are in a relationship, communicate. Shared intimacy compounds every benefit we discussed today. It adds the oxytocin of touch and the serotonin of connection to everything else. And please do not skip your prostate exams. All the ejaculation in the world is not a substitute for regular PSA testing, digital rectal exams, and honest conversations with your doctor. Here's what I want you to leave with today. The fact that you watched this video tells me something important about you. It tells me you are a man who is paying attention, who cares about understanding his body, who refuses to let silence or shame stand between him and his health. That is not weakness. That is wisdom. That is strength. Your body is not done with you. It is waiting for you to give it the right signals, the right information, and the right care. And the more you understand about how it works, the more power you have to live the second half of your life with real energy, real confidence, and real vitality. I'm Dr. Naomi Sato. Thank you for trusting me with your time today. If this video helped you, please give it a like, share it with a man in your life who needs to hear this, and subscribe so you never miss a week of honest, practical men's health content. Drop a comment below and tell me, what was the one thing from today's video that surprised you most? I read every single comment, and this community of men choosing to take their health seriously means the world to me. Take good care of yourself. You have earned it, and you deserve it.